my pleasure to open the session and sort of kick it off with a little background. I just wanted to really introduce the two other co-conspirators on our panel. Deb Whitman is the Chief Public Policy Officer at ARP and has been a long advocate of dealing with these issues, so it'll be very interested. And Mahmood Khan, CEO of Evolution Foundation and former scientific director of Pepsi. And we've already heard a little bit from you, but really interested in hearing some more. So I want to say that this session is focusing on the business case. And it's critically important because really only through partnerships with both public and private sectors can we possibly make progress in this area. For people who are in the business world, I've said often that people in business are used to modifying organizations all the time. They don't have a successful organization without being nimble and thinking about organizational change and new policies and ways to be better. But they often don't think about it with worker health or longevity in mind. They often have another purpose. But nonetheless, people in leading businesses reorganize fastly and think about it really all the time. So it makes it very convenient, I think, to think about what a business case really means. And in this case, the goal is to think about better health, financial, and productivity for Americans and people across the world globally. So what's the issue here? Why is it we have so many calls for working longer? They're met with a lot of confusion and contested sort of questions. And what I thought I would do is take a few minutes to kind of state what I think the problem is and what the facts are, and then turn to the two of you to think about what the solutions might be and where we want to move. So here's my experience of doing this. Working here is I was part of a Sloan Foundation advisory board for a very long time on working longer. And at the very end of it, somebody kind of whispered, who are we not counting? And there was silence in the room. And we thought, my goodness, we have depended on employment statistics, which count on people who are basically looking for jobs. We have not counted, and people are invisible, who have dropped out of the workforce in their 40s or 50s. We have no idea how many people those are or what the course of their careers has been, that we rely on a very narrow set of employment statistics, and so does almost every other country in the world, to make the kind of projections. So when you think about this invisibility, about who, over time, are we not counting, it turns out that it's an enormous percent of people. And so our data suggests that in the United States, we looked at the Health and Retirement Survey, and somewhere around 50% of people are in stable jobs through their 50s. So those people are potentially eligible to at least enter their 60s working longer. But the other half of people, a huge chunk of people, work at unpredictable and part-time and are jobs and are in and out of the labor force, and another percent of people are not employed at all. And together, that's the other half. So of the people who are employed, about 80% of them go on to work in their 60s. But of the people who are working part-time, about a third of them do. And the people who are not working, it's about 10 or 15%. And we know from other data, from work by Rich Johnson and others, that also not only do people have a hard time finding another job in their 60s, only something like 10% of people ever make the wage that they had gotten when they were in their 50s. So the earnings power for people who have been out of a job sometime in their 50s is really very dramatic. And it means that we have to think about labor policy. And so we've come to think, and I think this is where we really resonate, that labor policy is kind of the flip side of the coin of retirement policy. That you cannot think about healthy retirement without thinking about really changes in the workforce. So we'll talk about that, and we have done a fair amount of work at this, looking at evidence-based policies that work. We have a business website that's linked to America's Aging Workforce if people are interested. But before, I go further, I think what I'd like to do is turn it to the two of you. And Deb, first of all, is going to talk a little bit about the business case, and then let's talk about solutions, because this is one of the areas that I think data alone is not sufficient. Data is the first step, but we really need a set of solutions.
So I'm going to start because you didn't plug your book. Because the book that you guys just put out really barriers that older workers have. So I'm going to go into a little bit more depth, but just an incredible piece of scholarship to sort of open the eyes to policymakers on some of the issues that we'll talk about. So I heard 3 or 4 people say at least 3 or 4 times, people want and need to work longer. And that's a perspective that we have as well, and that we hear from people. They need to because they need the financial security. They want to because they are engaged in the workplace, that's a place where they find meaning and purpose. And we also know, as I think Linda's talked about, it can be good for their physical and even psychological health. But right now we put it all on workers to work longer. We assume, and this is the benefits of Lisa's book, we assume that we can just have policies like raise the retirement age and everybody can choose to work a year longer. And we don't take a look at what are those barriers that people face, like caregiving that we've talked about, like being laid off. I mean, you said 50% keep working. I'm going to point out 50% of people lose their jobs in their 50s. 50% in their 50s. So getting them to work to 66, 67, 68, and 69 is a little bit more difficult. And we've talked a lot about health declines. And so, and age discrimination also, if you lose your job, it makes it much harder to get a new one. So this not only costs individuals because they lose financial security, they lose attachments, they lose self-worth, but it really affects the economy. So if we just looked at fixing the caregiving problem, we would actually grow U.S. GDP by AARP's estimates by $1.7 trillion. We are losing out by not supporting people in the care that they already give. If we looked at people that get laid off, we already know that if they worked in the U.S. up to what they work in New Zealand or Iceland, the most advanced age working in the OECD, our GDP growth would be 13% higher by 2050. That's big numbers. And age discrimination costs $8 billion per year. So these are internal costs, but they're costs to our whole economy. So AARP does a lot on fighting age discrimination laws, helping to have caregiving laws, all kinds of things we do with governments. And we also provide resources to individuals. We are a communications company almost more than anything else. But we realized that people can't do it alone. What we wanted to focus on is the demand side for older workers. How do we get businesses to think about older workers? And there's been a lot of work on this. We have thousands of employers that sign our employer pledge that promise that they won't discriminate against older workers. That's actually U.S. law. But we wanted to take that further. How do we not just not discriminate, but how do we see the value? So we created a program with the OECD and the World Economic Forum several years ago called Living, Learning, and Earning Longer. And I'll just add the highlight was we focused not on older workers, but we focused on the multi-generational workforce. We got employers to think about things like tenure and age and stage and the value of having mixed age teams to increase productivity. We now have 84 companies that have signed on to be part of this learning journey with us. And we're taking the sort of best practices of how do we think about the multi-generational workforce further. But I want to give Victor and everyone who created the report that we're putting out today, Victor, it wouldn't have happened without you, you know that, a real thank you, because it's pushed us to even take this idea further. So our new push is, how do we get businesses to think about the value of healthy longevity for their workforce? And a couple weeks ago, and I want to thank Dr. Erwin Tan, who's here, AARP had a conference called Building a Competitive Future for All, and we released this wonderful report, which I think will be, there'll be links at the end, talking and looking at the data and trying to create the underpinnings of why employers should care. A lot of it was taken from your global roadmap, but also giving practical solutions for what employers could do to improve the health of their workforce. So this is new for us. AARP is really good at talking to our consumers. AARP is really good at lobbying. AARP is really good at lots of different things, but getting employers to change behavior is hard. And so I'm really glad we have our colleague here to tell me if we're on the right track of getting thinking about what works for, and motivates employers. But would really love as much help as that we can get to try and think through this project as we move forward. So I'm going to turn it over to you to hear.
You know, I always wondered how AARP knew I was going to turn 50 before I turned 50.
We
have their ways.
An amazing organization. Look, I asked myself to build on the question you just raised, which is, if you look at the statistics, the publications, the argument is pretty compelling. Massive impact on GDP globally, in North America, in the trillions. Check. If we look at the social value on families, etc., forget the financial, there's little debate. And then I asked myself the question, so why is it we have a gap between what we already know versus actually implementing it, right? To me, the gap is not understanding what policies are needed. The gap is not, at this point, the largest in the rationale, but the justification. And there's two areas that this raises. One, are we talking to the right people? We always have to ask ourselves, who are we talking to? If we're talking to people who are already convinced, ministers of health, etc., health system leaders, they probably already know that. Okay? If we ask ourselves the question, how often have we talked to ministers of finance, chief financial officers? Usually it's the HR department. Does the CFO really understand on the business value of this? Not in 20 years from now, but remember, they're dealing on quarterly calls, at best annual calls. How do we make it real with practical solutions for the now? And the second question I always ask myself is, whenever I'm going to see a senior leader, I always ask, what's the decision I want from this leader? Not everything else, but ultimately it'll come down to, tell me what you want me to do, okay? And if it's a politician, it's policy. If it's a CEO, it's like, implement this. And so I think one of the things that there's an opportunity here, huge opportunity, is to fill that gap. And say, and your website has some excellent tools. It still raises the question, who's reading it? And are the right decision makers actually reading it and saying, this is what I need to do today? And if we can get it down to that level of granularity, I think we're going to make a lot of progress. And one thing that industry does very well, a lot of gaps, but is industry knows how to compete. And if this becomes a competitive advantage, you won't have to sell it to anybody. Industry will learn very, very quickly how to compete. And by industry, I just don't mean just private sector. There's large health systems that are non-profit, but they're very competitive. And so the institutions that are competitive, the word will get around. So I think part of this discussions need to go to now, all right, let's get into the today, decisions today, not impact today, but decisions today, the practicality, and why it'll impact my stakeholders, whether they're shareholders or others.
Right. I think that's really compelling. And I think when I was talking about places organizing all the time and being responsive, I think it's that competitive nature of business, or at least business in the United States, that makes this really compatible with the way people think. I thought I would add one or two examples and then go around again. So in our summary of best practices, based on studies that were actually randomized, that we could look at, well, how did the change work? And did it produce something? There was a study in the Gap. So the Gap was really pretty well known for a just-in-time kind of environment where people were sent home. If they were busier, they were told they had to stay at work. There was no predictability to scheduling. And what the intervention did in this case, and this is the implementation part, very practical, what did they actually do? They actually gave people schedules a week ahead of time, right? So this is your schedule for the week. We're not going to ask you to stay an hour longer or go home earlier if there's no business. So people had more predictable schedules, and they made an app so that people could switch schedules with somebody else. So they didn't just sign in and not come. They had to find a partner who would come. And in the end of this intervention, it had a few more elements, but they were all oriented around schedule control and worker voice, workers having some decision making, which I think is incredibly important from the point of any kind of community participatory thing, for people to feel like they have a voice in how the place is run in some way. In the end, the people in the intervention group had better outcomes in terms of sleep and stress, but it also turned out to be more productive for the Gap. And the bottom line, they think, is that it turned out to be better for the Gap because they were able to retain better workers. So they had less turnover. And that, I think, is a consistent message in almost all the interventions that we've done, is that if the goal is in part to to decrease turnover or to keep the best workers working and in the workforce, that doing some of the reorganization around issues that have to do with schedule control, have to do with worker voice, and have to do with building social relationships, sometimes between managers and employees, sometimes between clients and employees. Those are the things, and it turns out that they're pretty practical. These were not monumental changes at the Gap. They didn't pay people more. They didn't give them more vacation. They didn't put in place a work and family leave sort of thing. They changed the way things were scheduled, and it worked out for the better. So I think these things are really possible. It's just that the science is very young right now. So when you think about, I guess what I'd like to do is come around again to talk about either successes that you've known, I mean, even at Pepsi, whether you have experiences with Pepsi or other companies, and then maybe we'll talk about things that you think are really impediments to that kind of thinking. So maybe, Mahmood, we'll start with you again.
Let me refer to two examples. We talk about the older worker staying in the workforce longer, elevating retirement age. But sometimes there's an assumption in that statement which means they'll continue to do the same job for longer. And that's a misunderstanding. Just because somebody wants to work longer shouldn't be assumed that it's that job. So then the question comes, on the employer side, what are the alternatives? Whether it's changing the job type. And we obviously think about, physical, manual types of jobs being converted, workers to others. But even within non-manual jobs, there are other areas. The second is, what's the opportunity to redeploy that individual, which is going to require some hiring manager to take on somebody who's actually not from coming vertically up within that. And I'll give you two examples. A few years ago, we were running out as an industry of product safety inspectors and regulatory reviewers. Nobody goes and does a degree in regulatory. Nobody actually goes and does a degree in product safety. And yet every manufacturing business requires safety review, and most require some sort of regulatory review. These are jobs in this country that have been vacant for 1 to 2 years. No fill. Now you can't run. We actually approached a number of institutions in this country. I said, if I send you some older workers, can you retrain them to become regulatory reviewers, or can we give them courses on product safety? Well, do you want a master's degree? No. Do you want this credential? No. I just want the courses. Couldn't get it done. Went to an international university abroad and figured out a curriculum. I just use that as an example because this is a partnership between an employer, a desire to keep employees that are critical in a new role, for which actually you could do 20 hours a week as well. These are roles that exist all over, and just as examples. But we need 6 months, 12 months of part-time training of previously pretty well-trained people. And the third piece I'd add is these are types of jobs that can be kept in more rural types of areas where we have to be cognizant of is otherwise it's not just separation through technology, there's physical separation going on because a lot of manufacturing is in rural parts of the country. We need people are living there. This divide is only worsened if we don't find, and that's a whole deep conversation. So you asked me for an example. That's a real example.
That's a great example. That's terrific.
I'll steal the most common one that I've heard over and over again. It's about the BMW plant that changed its floor to be more ergonomic so that people weren't lifting as much. And not only was that better for their older workers, obviously, but the health of their entire population, the disability rates, the productivity, all of those things went up. And I think, going back to the previous panel, really designing our whole life around the lifespan and about particular health issues actually can help people be more engaged.
Yeah. So I think you brought up both the importance of nobody has one job in their life anymore, right? Even if it's at one place, which it also isn't. They don't have one job. And so some kind of retraining, especially if we're going to want people to work longer, has to be built in. And it may not be, I thought the point about not having, you don't need a degree in it, you just need to learn it, is really helpful. And this idea of workplace reorganization is really central. It points to the fact, and people have said it before, that work is a fundamental social determinant of health. And so both it produces better health as well as it ought to be able to enable people to work longer and have more financial security. So what's the mess? Where are the barriers? Can we
do more on solutions?
I don't. Yeah, we can go back. I just want to say I went to one meeting where I consult a lot and work with a group at MIT, and there was one economist at the Sloan School who said, the problem with CEOs and financial officers is they just don't do the math right. Like, actually, whether it's short-sighted or however they're thinking about it, or whatever they think the return on investment is too narrow, but they're not doing the math right. If they did the math differently, they would understand sort of how good this is. So that's a great comment, but I have no idea whether this resonates or not. So just we'll go back to you with either solutions or why this isn't like easier to do.
Well, it's more than math, right?
Yeah.
It's okay. We can show them data, and I think it's in the roadmap itself, that improving the health of your workforce is good. But I think then it's like, well, what do I have to do and how much does that cost? And so one of the things that we tried to do, again, in my book that Erwin put together, which is beautiful, is really have concrete areas, and I think you did this really well in your own book, is what do you need to think about that's going to help keep workers there longer? And some of that is the benefits that you offer, which do have a cost, right? ARP started offering caregiving leave for our staff. And I have to say, the loyalty, the return on investment for people knowing that was there when they need it was actually pretty huge for just a few days of extra leave. And not everybody takes all of their leave, and I think I've taken 4 or 5 days with my family. But looking at your benefits structure and making sure that you have the retirement benefits and that they're actually helping across the workforce. You talked about learning and engagement. Unfortunately, 77% of training opportunities go to people 25 to 34. And so if you want to switch careers, if you want to try and keep people engaged and sort of growing and doing different things and learning new skills, we need to think about who's getting retrained within our companies. We also need to think about how we hire. And are we doing age-blind hiring? Are we looking across different cohorts of people in order to look for jobs? And we have to think about the culture, because this goes back to, I think, an underlying part of the whole thing, which is the ageist culture, and where people end up either feeling not included, not valued, or really taking their own view of their future down. So, we have groups that have young professionals and mature professionals as employee engagement groups. We have ones that, have added things like belonging and age into their DEI strategies and are really thinking about these issues. You talked about a lot of the workplace structure, which I hope I'll kick that back to you to go into more detail beyond just the scheduling. But I think all of these things, if you can get employers to have sort of a checklist, which we do, of ideas in which they can actually improve the health of their workforce, and here's the ROI for that. I think it needs both sides. It needs the argument for and the tactics to do.
Great.
The thing I would build on, I agree with totally. Whenever you bring about organizational change, most often than not, you need courageous leadership. It's not enough to present data, and I think this audience is full of leaders, but when you've really made a difference in an organization, no matter small or large, it's happened because a small group, if not an individual, had the courage to challenge the norm and make a tough call. And to do that, you need the air cover from some board, usually, board of directors, board of trustees, whatever. But every CEO has a board, and you need a board that's aligned and the right timing in the organization for that leader to say, we're going to take this on. Once that happens, and it's followed by success, and this happens at a country level too, those who are sitting on the sideline will watch that early adopter and say, well, this is a great idea. And now it becomes a movement. My definition, it's not original to me, but the one I like, is the difference between a dream and a vision is a vision is a dream seen by many. A leader's job is to take his or her dream and make it the vision of everybody else. And so the question really, I always ask myself, in order to have this done, what is the vision? Who's the leader that's going to embrace this vision? And then thirdly, has the courage to bring along their stakeholders and say, I'm going to put myself on the line and take this on. I think if that happens, we will start to see this issue go from an intellectual academic discussion to now clarity of vision, and it starts to democratize. I personally believe we're at that inflection point, and it is the job of the experts now to hand it over from being in the domain of experts to actually in the domain of decision makers, who we give them the courage to say, get behind this. And there will be failures. That's the whole point of having the courage. But each time will be better. You know, I always tell my people, the Wright brothers didn't build a 747, they got a plane off the ground. It's time to get this off the ground.
And one of the things we focused on our conference a couple of weeks ago was having business leaders do the talking. Because you're right, I think they listen to each other. So we had the CEO of CVS who turned from a pharmacy into a healthcare company. And they're looking at these types of practices for their own workforce and to engage them longer.
I think that's critical. It sounds like often we make a mistake by not engaging the right audience, and it sounds like at least part of the strategy has to be addressing leaders of companies, CEOs, CFOs, whatever, in this conversation, and not people who are still looking at narrow kind of benefits kind of range, or not I would say, doing the math right in some way. I'd like to turn a little bit to the issue of heterogeneity and inequality, because one of the things that was so striking about who it is who works through their 50s steadily is hugely socially patterned. This is not a random hit where this happens. It's completely socially patterned, not completely, but largely socially patterned. People who are with less education, people who are commonly discriminated against or marginalized, so along racial and ethnic lines, gender lines, age lines, all of these groups get hit more often. And so by the time that we look at inequality in retirement savings or something, it's a lifetime of earnings and a lifetime of more precarious jobs, worse jobs, less flexibility, and that sort of thing. So I think at the end of our book, we concluded that there is no one solution here, that the issues are really, truly around heterogeneity, that we all may be able to work till we're 80-something, and maybe will, but there are a large number of people out there who are struggling to make it through their 50s. So there need to be two solutions. Some set of people can work longer, and if we raise the age of retirement, they would probably do that. But some huge set of people are not going to be able to work longer, and they need some path to financial security. Large numbers of people have some kind of disability, which at this point takes them out of the labor force. But in fact, they could be in. I mean, I think in the earlier session we talked about this. With some more workplace redesign, people with disabilities could actually stay in the labor force, work part-time, that kind of thing. I mean, I think long COVID is going to teach us about how that plays out. So when you think about the issues of inequality again, like I'd like us not to talk about the people who are like the best off, but what about all the people who honestly have very tough jobs, and then tougher family lives and a lot of responsibilities at home that get balanced, and what are the solutions there?
Inherent in what you just said, there is no one solution that fits everything, right? We're talking about a very heterogeneous set of problems. One set, of course, is people want to continue doing what they want to do, just let them work longer, right? They're in that privileged position, fine. The other end of the spectrum is the people you just raised, which is they've been in a sequence of jobs, and they're in an environment where they can't either continue to work or they haven't been working for a long time, right? Huge difference. I think we're going to have to come up with a portfolio of solutions, first of all. I think anybody who says, we're going to come up with the solution, it's not going to happen. There's going to be a lot of granularity, and I think we need to customize, we need to understand, but then use, we can do a lot of research now for the next 10 years and get the data. It's necessary. We'll continue. But we have people retiring now, and we have employers who need jobs, who need workers now. So I'm always of the mind, what do I take as best practice now, and what do I learn for the future? We've talked a little bit about best practice. But let me raise the question of technology. A number of people have raised it. Technology can cause divide, but technology can be a great equalizer for solutions. Now, you go back when we were young, cell phones were a rare, rare privilege. Today, that's not the case. They were democratized because of very innovative business innovation. It wasn't technology innovation, it was business innovation, new ways of bringing costs down in ways we'd never imagined, right? As I look to the future, it raises the question, when we go Web 2.0, Web 3.0, Metaverse, etc., what is that work environment going to look like? How is that going to engage an older population in ways that we haven't thought about? So, need to work on that. Okay. Separate to that, there are new jobs being created. We all hear about the unemployment. There's many new jobs being created. What can I do to pivot? We touched on this. And what's stopping that? And I think this is where policy, government, and the employer can work together. I think a major question is, we can prevent poverty literally by keeping these people, we know that, in the workforce. Do we have real social experiments going on? Are there examples in different countries that we can bring in? It doesn't have to be invented here. And I think there's enough going on around the world that we look at different models, and that will bring granularity. We can get into specifics, but take that as a start for examples.
Yep.
I'd agree, and I think, if we just take our natural experiment of COVID, which has shifted the workforce dramatically, people having more flexibility to work where and when they want, has been a great boon for older workers to continue working. Andrew Scott just recently released some research about the rise of age-friendly occupations, that more jobs are becoming age-friendly. Unfortunately, most of those jobs are going to younger, highly educated workers. And so even that can up the disparities in the same way this hybrid environment is also for more highly educated workers. I was really inspired by Fernando's point that the Master Plan on Aging in California has a component that looks at younger people of color and says, what can we do to improve their health at a younger age so that as they age, there isn't as much disparities. I do think we need to really be broad in our view, and there's going to take a lot of pieces, but I think for some populations to really unearth disparities that happen, that you see in the 50s, 60s, 70s, 80s, 90s, you're going to have to start addressing them in the 20s, 30s, 40s, and 50s.
I think that's a really critical point.
Recording in progress.
I'm glad somebody decided.
Reassuring. In order for us to address these kinds of disparities, absolutely life course issues come into play. And even if we only think about work, it's very clear that, helping people who are 62 to get to 65 or 67 is totally on the margin, not maybe useless, like it will have some effect, but like it really needs, in order to address this issue directly, think about middle-aged and earlier.
Can I tell you my favorite one that I heard
Go for it.
little while ago? So I was talking to the treasurer from Wisconsin, and they're trying to push a plan called 401 Kids. And so this is, for many people who've worked on baby bonds are shown to really, you give a grant to children, and then those accounts can be used for education. And that helps families to have an account so that they can add to it, but also helps the kid to sort of see a future. I have a college account, so I'm going to go to college. What's exciting about 401 Kids is that account can be used for school, it can be used for a home, or it can be used for retirement. And it's really, again, Wisconsin is a purple state. It is, I think, the more conservative argument of getting people to have access to the financial markets and the benefits of investing over time is combining with maybe the more liberal argument of we need to help low-income kids have a future. And I think these types of innovations, starting very young, can have a lifelong effect on people.
That's an excellent point. So before we close, Mahmoud, is there a last point you'd like to come back to?
No, because let me just emphasize, I'm going to quote my friend Linda Fried here, who reminds me that public health and the traditional medical care are two sides of the same coin, right? Or pretty close, I think, Linda. I'm trying to be a good student. This is not a if, either or. There's macro level policy things that we have to change that are broad, such as the California example. But often the implementation of them is going to be at a granular level. And you have to balance that. And the point I think we're hearing here is think macro of what are the major drivers and the levers we need to touch on. But often, as we heard in our earlier session, the implementation is nuanced at a community level, which varies between community, between industries, between employers, and even types of jobs and individual preferences. So I think the essence here is how to bridge the two. And I think if we talk only on one or the other, we're not going to succeed. This is not competing. This is actually allowing integration of the two. And the question I want to leave people with is, who are the groups or individuals and leaders that will help us bridge that? If we can find that, how to bridge those two, I think we're going to make a lot of progress. And I think this roadmap has started the process of that bridge. Okay?
Can I poke you a little bit? Who do you think they are? Who would be your top 5 people?
I'd put actually community leaders at the top, not employers and not executives like myself. I'd put community leaders. Community leaders have a huge amount of influence on individual behavior, disproportionate to what we've traditionally thought. The second is the point I think you touched on, the educational process of how this is being prioritized. You want to take care of the elderly today, educate the young. Not just about their elderly, their aging, but how they see their older population. We have a lot of work to do there at the educator. I mean, look what happened during COVID and some of the beliefs, right? And then the third comes to very much the decision makers in institutions, which may not be the ones, and I alluded to this earlier, that you immediately go to. And get those decision makers. So that, to me, it's that hierarchy.
That's really, really, really very articulate way to end this. I think I would just add that what we've all ended up with is close to something that really resonates in the roadmap volume as well, which is that there's a huge need for things to be multi-sectoral, that there isn't one sector ever that will be exclusively the arbiter of this. And when we come back to think about public and private sector solutions, I really also want to emphasize that the business community and the private sector has a lot to offer, but so does the public sector. And so we can't give up on sort of public policies that will help to kind of nudge this along. But together, there can be a lot of drive towards solutions. So thank you very much, and I think we will wrap this up. Thanks.
Great.